Welcome to episode 2 of the GetLyfe podcast. I'm your host, Clarence Holmes, and today we're talking about a topic that is incredibly important for anyone approaching or already enrolled in Medicare. That's right, the 2024 Medicare open enrollment is about to happen starting October 15th through December 7th of 2024. And on today's podcast, we'll be covering some essential information. So if you know anyone who is 65 or older or turning 65 soon, please share this episode with them. So whether you're new to Medicare or looking to make changes to your existing plan, this episode will give you all of the information you need to make the best decision for your health and your wallet. So let's get into it after the intro.
Welcome to the GetLyfe podcast, where we cut through the noise and bring clarity to your financial world. Join your host, Clarence Holmes, as he unravels the mysteries of money management and turns complex concepts into easy-to-follow, actionable insights.
All right. So thanks again for tuning into the GetLyfe podcast. And like I said earlier, we are discussing Medicare. So if you know anyone that is approaching 65 or 65 and over, then please refer them to this episode. So let's talk about what Medicare is and who it's designed for. So first off, Medicare is a federal health insurance program designed for individuals who are turning 65 or 65 and over. Typically in the past, people would retire around this time, so they would no longer have medical insurance from their job, hence Medicare. Now, Medicare comes in 4 parts. Parts A, B, C, and D. And don't worry, I'm going to break these parts down for you so that you have a better understanding of how each works. So parts A and B are usually grouped together. Part A covers hospital benefits. So if you are admitted to the hospital and you have to stay overnight, Part A covers that. Part B covers outpatient care and doctor visits. Part A is usually the only one that you can get for free if you have met certain criteria. And this is in conjunction with your work history. So to qualify for free Part A, you must have earned at least 40 work credits. And these credits are typically earned by working at a job and paying Medicare taxes. You can earn up to 4 credits per year. So 40 credits would equate to about 10 years of work history and paying into those medical taxes. And for those of you that may be wondering, well, I've been an entrepreneur, I've been doing my own thing, I haven't really made those 40 credits. Don't worry, if you still want that particular Medicare, you can get it. You'll just have to pay a monthly premium for Part A. Moving on to Part B, that's your outpatient care, doctor services, preventative services, and medical supplies. Part B does not require you to have work credits. Anyone who's eligible for Medicare can enroll in Part B, but there is a monthly premium that must be paid regardless of your work history. And that premium is projected to be around $175 roughly, although it could be higher depending on your income. And that's pretty much the gist of Medicare Parts A and B. Remember, A is for your hospital stays, B is for your doctor's visits. A is going to be free if you've worked at least 40 credits. B, you're going to have to pay a monthly premium for roughly around $175 per month. And again, that's going to be, it could be higher depending on your income. You know, at GetLyfe, we have a survey or a poll that you can take right now if you're listening to this podcast after you finish subscribing and listening to it. Head over to getlyfe.com, GetLyfe.com. Scroll to, I would say, the middle section, maybe closer to the bottom where you see the show, the GetLyfe podcast. Click on that little button that says Take Survey and let us know what topics you'd like us to discuss. Next, we'll be right back with part C and D and some more things that you need to know about Medicare after this commercial break.
Attention business owners, are you struggling to keep up with your social media? Let Brightpost Daily simplify the process for you. For just $29 a month, our AI-powered system generates engaging social media content and visuals for you. Just provide us with a few details about your business or your website and watch as we create and post content automatically. No more brainstorming or posting hassles. Just fresh, consistent updates across all your social media platforms. Visit brightpostdaily.com today to start your stress-free social media journey. It's quick, easy, and affordable. Brightpost Daily. Your social media, effortlessly elevated.
Okay, welcome back to the GetLyfe podcast. And in today's episode, we are talking about Medicare. We just covered parts A and B. Now we're moving on to part C and part D. So part C is also known as a Medicare Advantage plan. And part D is very easy because the D stands for your prescription drug plan. Let's talk about Medicare Advantage, which is the part C. So Medicare Advantage plans are offered by private insurance companies. And what they usually do is they bundle your Medicare Part A and B coverage into one plan. Many of these plans also include Part D, which is the prescription drug coverage, and some even offer additional benefits like vision, dental, and hearing. The good thing about that is you have everything bundled into one package, but these type of plans often require that you use a network of doctors and hospitals. So it's crucial to check and see if your preferred doctors are in that network before you sign up with that particular Medicare Advantage plan. Medicare Part D, this is the prescription drug coverage plan. My only advice for this is if you don't take many medications right now, it's important that you still enroll in a Part D plan when you're first eligible. And that's just so you can avoid late penalty fees if you try to enroll in that plan later on. So at this point, you should pretty much have the basics of Medicare plans parts A, B, C, and D. So now I just want to give you a little bit of information of what you should consider when you are enrolling in your Medicare plans. The first thing is called a Medigap plan. First of all, they're sold by private insurance companies, and what they do is they help pay for some of the healthcare costs that original Medicare doesn't cover. So again, remember, original Medicare is A and B only, so that's your hospital stays and your doctor's visits. Medigap plans typically pay for part or all of the remaining costs after original Medicare pays first. So if you have high copays and deductibles, then you definitely should consider Medigap. Just one last thing to note, if you have a Medicare Advantage plan, which is A, B, C, and D, typically you cannot get a Medigap plan because it's only for original Medicare, which is parts A and B. Next, let's talk about changes in your health. So if your health has changed in the past year, it might be time to review your plan. For example, if you've been diagnosed with a new condition or if you're taking new medications, you definitely want to make sure that your current plan still covers your needs. That goes for Medicare Advantage plans too. If you're considering a Medicare Advantage plan, just make sure that your doctors and preferred hospitals are in that network. And as far as the prescription drug coverage, just make sure to review the Part D plan to ensure it covers your current medications. But speaking of Part D, starting in 2025, there will be a new $2,000 out-of-pocket spending cap for Medicare Part D. So what this means is once you spend $2,000 on out-of-pocket covered prescription drugs, you're done paying Part D copays and coinsurance for the year. So that's basically it. Finally, I just want to stress the importance of taking action during this enrollment period. The deadline is December 7th, and if you miss it, you could be locked into your current plan for another year unless you qualify for a special enrollment period. So don't wait until the last minute. Take the time now to review your options and make any necessary changes. One last thing though, if you're searching a Medicare Advantage plan, some plans offer additional benefits like gym memberships, transportation to medical appointments, and some even offer coverage for over-the-counter medications. So make sure you check those out because they can add value to your plan. So that is a wrap for today's episode of the GetLyfe podcast. I hope this information helps you to make the best decision during the Medicare open enrollment period for 2024. And as always, if you found this episode helpful, please share it with someone who may benefit from it. Don't forget to subscribe to the podcast. You can actually go to getlyfe.com. That's GetLyfe, and choose your favorite streaming platform. There you can subscribe to us and also catch up on our first episode that we had last week. So until next time, take care of yourself and your finances. I'm out.
Planning for the future can be daunting, but securing peace of mind doesn't have to be. At GetLyfe, we specialize in final expense services with whole life insurance policies designed specifically for people over 65. Imagine having a plan that covers your final expenses and ensures your family isn't burdened with unexpected costs. With GetLyfe, you can get free, no-hassle online quotes to find the perfect whole life insurance policy tailored to your needs and budget. Our dedicated team is here to make the process simple and stress-free, guiding you every step of the way. Don't leave your loved ones in a bind. Visit GetLyfe.com today and take the first step towards a secure and worry-free future. GetLyfe, because your peace of mind matters.